I guess if you've had a transient event, this wouldn't be so relevant, but if you had a stroke and you come through a stroke service, your therapy team, in conjunction with the medical team, will decide whether you need immediate rehabilitation, and actually your rehabilitation starts on day one. So on the hyperacute stroke unit, you will be seen by an occupational therapist, a physiotherapist, a speech therapist if you need, and maybe even a psychologist if there's problems with memory and thinking. That is then a process. So from the hyperacute stroke unit, the first place you get to, you'll be moved to an acute stroke unit, and that may be within the same hospital. Often it's in another hospital near your locality, and the reason for that is we want to put you in your locality so you can engage with services in your community. And those community services are the community rehabilitation services. So you'll go from the acute stroke unit, where you'll be continuing to get therapy every day, and then you'll be moved to a community either rehabilitation hospital, so that's still a hospital type environment with less medical input, I guess, and more focusing on therapy. And what do we mean by that? It's focusing on your disability. So if you've got weakness and you can't move your arm, so you can't make a cup of tea, you can't lift it, you can't write, you can't use it to brush your teeth, you can't comb your hair, you can't do your washing, it's focusing on those more tasks, functional related activities. Everything at the beginning is in your treatment and that acute stroke, but later on we're focusing on how do we get you back home and functioning. And that might not be as severe as, for example, I can't move my arm and my leg and face, so I can't wash myself. It might be, I want help getting back to work. And there are vocational rehab services which we offer at Queen Square. It might be I can't really see on one side, and there's a specialist hemianopia clinic which we run at Queen Square. There's also rehabilitation services in the community hospitals, but also once you go back home, there are community rehabilitation services in the early stage, which are called ESD, the early supported discharge teams, and they will offer therapy in the form of physiotherapy, occupational therapy, and speech and language therapy. So I guess it depends, what are the disabilities that you have left? So is it strength? Is it mobility? Is it vision? Is it speech? Is it swallowing? And your therapy should be tailored to that.